Good afternoon. I'm Father Ty Hullinger. I'm the pastor of St. Anthony of Padua, St. Dominic's, the Most Precious Blood parishes in Baltimore City, proud to be in Delegate Cheryl Glenn's district. Today I'm also, though, representing Interfaith Worker Justice of Maryland, a coalition of clergy and congregational members of churches, synagogues, and other faith institutions around Maryland who are advocates for worker justice issues. I'm also speaking today on behalf of the many faith-based coalition partners of Working Matters, including but certainly not limited to the Maryland Interfaith Legislative Committee, the Presbytery of Baltimore, Jews United for Justice, the Baltimore-Washington Conference of the United Methodist Church, the Episcopal Diocese of Maryland, and the Maryland Catholic Conference. Today we know over 40 million workers throughout our country do not earn a single paid sick day. And that includes over 80% of low-wage workers. Unfortunately, it's much the same here in Maryland for our low-wage workers. We believe that hard-working but low-wage paid workers deserve better. We strongly support House Bill 968, the Maryland Earned Safe and Sick Leave Act, because every worker has the right to care for their family without losing their wages, without having the paychecks cut short, as we saw in the family testimony of the video earlier. Our faith traditions teach us that workers have a human right to receive health care for themselves and their family members, and workers have the right to receive a wage that will allow them to do so. From our sacred writings we hear, "You shall not withhold the wages of poor and needy workers, because their livelihood depends upon them." It comes from the book of Deuteronomy, which is, I know, inspirational for at least 3 different faith traditions. Parents should not have to choose between their jobs and their paychecks and staying home to care for a sick child. Low-wage workers and working families shouldn't have to sacrifice their hard-earned pay just because they or a family member become ill or need to seek a secure and safe environment. Maryland's faith communities are united today with these workers, many of whom have testified here today, and I worked with Randy many times. I know we've come full circle. A testimony started earlier, a few hours ago, in a completely different context with a completely different bill, talking about what how healthcare issues impact workers and their families. And we're continuing that story today, and we just believe that as Maryland's faith community representatives, now is the time to secure this opportunity for all of Maryland workers, but especially those who earn the least, but oftentimes work just as hard, if not harder, than most of the rest of us. We strongly support House Bill 968. We urge a favorable report for this very important piece of legislation. Thank you.